Click. I have to edit that part out. Okay. All right, so just as a test, I want to talk to you about vitamin D. Okay. Yesterday we talked about osteoporosis. We said osteoporosis is a tremendous epidemic problem in the United States and around the world. And we know that, just watch TV. Because every evening we see ads for Caltrate and Citracal, and Sally Fields comes back from her previous job as Gidget and the Flying Nun to tell us about how she takes Boniva once a month. And that's important because osteoporosis is a terrible problem. As we age, in America in particular, there is a decrease in bone mass, particularly in women, and that decrease in bone is called osteoporosis. Okay? Then, when it decreases, we find that you face the risk of a fracture. And a hip fracture or a collapse of your vertebrae is very dangerous. It can be deadly. In a lot of cases, it's an early sign that leads to death of that patient. So you need strong bones. And up until a couple of years ago, we thought we had the solution, which was, I bet you guys have heard it, more calcium. Eat more calcium. Drink more calcium. Take more calcium. Well, it turns out some fairly large studies show that taking tons of extra calcium only helped a little bit. So bathing yourself and constantly eating Tums every minute is only slightly helpful. We all should take a little extra calcium. That part of it seems right. But tons of extra calcium doesn't make much difference, and the little bit of extra calcium seems to only make a little bit of difference. Now, the hot new area of research that I wanted to put on the video for you this morning is something we talked about yesterday, and that is the old vitamin D, which 100 years ago we thought we found the problem of vitamin D. It was called rickets, and people had, little poor babies had bow legs and bad bones and stuff like that, and we fixed it by adding some vitamin D to milk, and that was kind of the end of the story because we didn't see any more rickets. Well, we've been able to get a serum measure of vitamin D, okay? But up until 5 or 6 years ago, to measure a vitamin D level in your blood would cost $1,000 bucks. Cost a lot of money. So we did it in some studies, but it wasn't very often. Now, the vitamin D has been added to these big machines where they run through and get 1,000 tests for 10 cents. So we now can get vitamin D levels on everyone. So not everyone, but almost the whole world, we've measured their vitamin D. And what we found is vitamin D deficiency is very common, bless you. But in particular, a recent study published in May of this year looked at the incidence of vitamin D deficiency in heavy people, which is important to our group this morning. In their study from Cleveland at the St. Vincent Charity Hospital, they found 80% of preoperative gastric bypass patients had vitamin D deficiency. So basically, if we throw a dart out in the room today and I hit anybody, you've got vitamin D deficiency. So, what does this mean? Well, number two that they did is they said, we found a lot of vitamin D deficiency, so we treated people. That makes sense, right? They gave them vitamin D. Even with treatment, still 40% when tested were vitamin D deficient. So what we're finding is you have to hit it pretty hard. So beware of it. We want to educate our patients about it. This is pretty new stuff, and we'll probably be looking into it further and giving you further advice as the specialists and researchers in this area begin to advise us. But it's the hot new area, and with low vitamin D, there's no question that you have problems with osteoporosis. And a lot of the osteoporosis research now is suggesting that calcium is important, but vitamin D may be really key. Now, the reason I want to mention that is I want to talk about something else that you know about vitamin D. Where do you get it? Going out in the sun. But we have this other batch of doctors who say, don't go out in the sun, right? All the dermatologists. So they're busy scaring us, saying, you know, the world, we're all going to get skin cancer, so wear a hat, wear full clothes, don't go out in the sun, and all that stuff. And now you have kind of two camps. You have the vitamin D researchers, and what they show is the more sun you get, the more vitamin D you have. And a lot of us now live in houses. We don't go out that much in the sun. And so they're saying part of this low vitamin D epidemic is because we're out of the sun too much. whereas the dermatologists say we're in the sun too much. At least what we're recommending now, and what I'm putting on the video today, what I recommend to you, is the moderate suggestion is every one of us should be out in the sun for at least 20 minutes, uncovered as much as possible every day. Beware particularly of, say, well, I haven't been out in the sun for 2 weeks, I think I'll go out on Saturday and burn to a crisp. Everybody agrees that's wrong. So that what we want to beware of is sunburns in particular. But some sun every day is probably good. And so that's the latest research on osteoporosis, and I thought I'd do a little video on that this morning for us. And I'm going to use that to test my new little camera. So now I say stop capture, and that was 5 minutes and